When disaster strikes the marine environment, few images evoke such profound distress as an oil-covered seabird. These are not merely animals stained by pollution, they are victims stripped of their very ability to survive. Oil compromises their natural insulation, rendering them vulnerable to hypothermia, hinders their buoyancy, making flight and foraging impossible, and poses a deadly internal threat if ingested. The sight is a stark reminder of humanity's impact, signaling an immediate and urgent call for specialized intervention, far beyond what conventional animal rescue can offer. This is where the extraordinary journey of wildlife rehabilitation begins. The initial phase of an oil spill response is a race against time, fraught with unique challenges. Oiled birds are not only struggling with their compromised physical state but are also often hypothermic and utterly exhausted, making them elusive and difficult to approach. Rescuers, comprising highly trained professionals and dedicated volunteers, must navigate treacherous conditions, sometimes through oil-soaked terrain or choppy waters, to carefully capture these vulnerable creatures. The priority is immediate, gentle capture to prevent further stress or injury, ensuring they can be transported quickly to a specialized care facility equipped for this unique emergency. Rescuing an oiled seabird is a complex undertaking that extends far beyond the capabilities of a typical animal shelter or veterinary clinic. These specialized rescue types demand facilities purpose-built for the unique needs of marine birds. These centers feature temperature-controlled environments, specialized washing stations, heated pools for post-cleaning recovery, flight enclosures for conditioning, and isolation units crucial for preventing the spread of diseases. This infrastructure is staffed by highly trained veterinarians, marine biologists, and rehabilitation specialists, alongside a dedicated force of volunteers, all working in unison to provide intensive, round-the-clock care that cannot be replicated elsewhere. Upon arrival at the rehabilitation center, each bird undergoes a meticulous intake process. The first step is stabilization, addressing immediate life-threatening conditions like severe hypothermia or shock. Birds are gently warmed and often given oral rehydration solutions to combat dehydration, which is common due to their struggle and inability to forage. A thorough initial assessment is then conducted by veterinarians and trained staff. This evaluation identifies the species, estimates the extent of oiling, checks for visible injuries, and notes their overall health status, establishing a baseline for their long and challenging recovery journey. Every detail matters. Before the washing process can even begin, the birds need to be adequately prepared. This pre-wash stabilization is crucial. It ensures the bird is strong enough to withstand the stress of cleaning, which can be physically demanding. They are often given several hours, sometimes even a day or two, to rest, receive fluids, and regain some strength in a warm, quiet environment. Only once the bird is deemed stable and medically ready will the cleaning team proceed. This methodical approach minimizes additional trauma, increasing the chances of a successful rehabilitation rather than rushing into a process that could prove fatal. The actual washing process is a delicate ballet of precision and care. It requires specialized cleaning agents designed to break down oil without harming sensitive feathers or skin. Famously, common household Dawn dish soap is highly effective, revered by rehabilitators for its ability to cut through grease. The birds are washed in warm water, typically maintained at a precise 100 to 105 degrees Fahrenheit, 38 to 41 degrees Celsius, ensuring the bird remains comfortable and warm throughout the procedure. Each feather must be individually addressed, a painstaking task performed by skilled hands, working methodically to remove every trace of oil. The cleaning process is rarely a one-time event. Birds are typically washed multiple times, sometimes requiring several rounds of soap application and rinsing to ensure complete oil removal. The challenge lies not just in getting the oil off, but in ensuring no residue remains, as even microscopic traces can hinder the feather's natural waterproofing. Following each wash, an even more critical step is the meticulous rinsing. Water must flow over the feathers until it runs completely clear, indicating all soap and oil have been removed. This careful balance of thorough cleaning and gentle handling is paramount to their recovery. Once the bird is thoroughly clean, the next critical phase begins, drying. This is not a quick process. Birds are typically placed in specialized drying chambers equipped with forced air dryers, which help to gently lift and separate the feathers. This takes hours, allowing each feather to dry completely. Following the initial forced air drying, natural preening becomes crucial. The bird, now unburdened by oil, will instinctively begin to preen, distributing natural oils and interlocking its feathers back into their perfect, waterproof structure. This natural behavior is essential for their eventual survival in the wild. The ability to repel water is paramount for seabirds. Without it, they cannot maintain body temperature or buoyancy. The rehabilitation process culminates in the restoration of this vital function. Re-waterproofing is critical, and it happens through natural preening. A seabird's feathers are designed to interlock perfectly, creating a dense, waterproof barrier. Oil destroys this structure. Once clean, the bird's instinctual preening redistributes natural oils and realigns the barbs and barbules of its feathers, restoring the integrity of this crucial barrier. This process is carefully monitored, as a bird cannot be released until its waterproofing is fully restored. While the external cleaning addresses the visible contamination, one of the gravest threats to oiled seabirds comes from within. Ingested oil, a common consequence of preening to remove the substance, can cause severe internal organ damage. The liver, kidneys, and gastrointestinal tract are particularly vulnerable, leading to organ failure, anemia, and immune system suppression. This internal poisoning necessitates specialized veterinary care, including diagnostics, fluid therapy, medications to support organ function, and often a carefully controlled diet. The fight for survival is not just on the surface, it's a battle against systemic toxicity. Addressing internal damage requires an intensive level of medical care that goes far beyond what general veterinary practices typically offer. Highly trained avian veterinarians employ advanced diagnostics to monitor organ function and tailor specific treatments. This can include targeted medications to protect vital organs, anti-inflammatories, antibiotics for secondary infections, and nutritional support through specialized diets. Isolation units are critical here, preventing stress and the potential spread of disease among vulnerable patients. Each bird's treatment plan is unique, reflecting the severity of their oil exposure and individual health status, demanding constant vigilance and adjustment. Cleaning and medical treatment are only half the battle. Before a bird can be released, it must regain its full strength and ability to thrive in the wild. This involves a comprehensive pre-release conditioning phase. Birds are moved to larger enclosures, often equipped with heated pools, allowing them to swim, dive, and practice foraging behaviors without the stress of an open ocean. Flight enclosures are also essential for species that fly, enabling them to rebuild crucial muscle mass and stamina. This period helps them to recover physically, mentally, and to prove their waterproofing is fully functional. One of the most crucial assessments during pre-release conditioning is the swim test. This is the ultimate proof that the bird's feathers have regained their perfect, waterproof integrity. Rehabilitators carefully observe the bird in a pool, checking if water beads off its feathers effortlessly and if it maintains natural buoyancy without becoming waterlogged. A bird that fails this test must return for further drying, preening, and sometimes even another gentle wash. Only when a bird can confidently swim, dive, and stay perfectly dry, proving its natural insulation is fully restored, is it considered ready for the next step towards freedom. Before the momentous day of release, each bird undergoes a final, comprehensive health examination. Veterinarians ensure there are no lingering medical issues, that the bird is at a healthy weight, and that its blood work indicates full recovery from any internal damage. Many rehabilitated birds are also banded with lightweight, unique identification tags on their legs. These bands provide invaluable data if the bird is sighted again, helping scientists understand migration patterns, survival rates post-release, and the long-term success of rehabilitation efforts. This final check is a testament to the meticulous care invested in each individual life. The release is the culmination of weeks, sometimes months, of intensive care, dedication, and hope. It is a powerful, emotional moment for everyone involved. Birds are carefully transported to an unoiled, safe environment, away from human disturbance and with ample food sources. As they are gently placed on the water or in open air, watching them take flight or swim strongly away is a profound reward for the tireless efforts of the rehabilitation team. It signifies not just the survival of an individual bird, but the resilience of nature itself, aided by human compassion and expertise. It's a second chance at life. Behind every successful rehabilitation story are countless unsung heroes: the highly trained veterinarians, the dedicated marine biologists, the tireless volunteers, and the emergency response teams. Their expertise, compassion, and unwavering commitment transform what seems like an insurmountable disaster into a beacon of hope. This specialized work requires not only scientific knowledge but immense patience and empathy, often under stressful, high-stakes conditions. Their work underscores a fundamental truth: with the right resources, techniques, and human spirit, even the most dire situations can be met with profound impact, one life at a time. The journey of an oil-covered seabird, from rescue to release, is a testament to the specialized techniques and facilities required for such a unique and critical rescue type. It's a process demanding immense resources, scientific understanding, and profound empathy. While prevention remains the ultimate goal in protecting our marine ecosystems, these rehabilitation centers and their dedicated staff offer a vital lifeline when spills inevitably occur. They stand as a powerful symbol of our capacity to mitigate harm, to heal, and to restore, ensuring that even in the face of environmental catastrophe, hope for a fragile future endures.